The word continence is a derivative of first ancient Latin, continent, or to contain, or hold, or exercise restraint, and second, modern English, to control urinary or fecal discharge. Add the describing word urinary and the prefix in, and it means loss of bladder control, or a leaky faucet. The simple words urinary incontinence, however, define a single symptom with multiple and complex causes. It's this symptom that vexed 20 to 30% of young female adults, 30 to 40% of middle-aged females, and 30 to 50% of the female elderly. In general, twice as many women have incontinence than men, with men developing this condition mostly due to prostate problems as they age. By far, the most common kind of urinary incontinence happens because of weakness in the pelvic muscles that open or close off the flow of urine. The loss of strength of these important muscles can happen in women because childbirth or surgery injures the nerves, muscles, and ligaments below the urinary bladder, or because these muscles are simply not exercised enough, and over time muscle tone relaxes too much to hold back the urinary flow. This kind of leakage is called stress incontinence because it usually happens in women when she stresses her bladder by lifting or coughing or sneezing or laughing at an unprepared time. If you ask anyone dealing with this, however, they'll tell you stress incontinence is no laughing matter. Another type of urinary incontinence is called urge incontinence, when there comes a sudden need to urinate without enough time to get to the bathroom. This occurs when the muscle that surrounds and squeezes the bladder goes into uncontrolled spasm, making an urgent urge to go. This can happen if there is irritation of the bladder from infection, tumor, overdilation. Also, certain medicines, an oversensitized set of bladder nerves, or even an over-awareness of the sensation of urine within the bladder can bring this urgent urge and incontinence. There's also overflow incontinence, when the bladder is overfilled from an enlarged prostate blocking flow, or from the loss of bladder squeeze from diabetic neuropathy, for example. Functional incontinence occurs when the brain or bone disease prevents the individual from being able to get to the bathroom. But most incontinence is from either stress incontinence or a combination of stress and urge incontinence. The treatment for urinary incontinence is dependent on understanding that exact cause or causes for the problem, and in recent years has resulted in a whole new subspecialty helping us deal with a leaky faucet.